Hey guys, hi, welcome to Unacademy. This channel is Unacademy for doctors, and I'm your educator for biochemistry, Dr. Shivangi Shukla. Let me just check if I'm visible and audible to all of you. I'll just check if the stream has started or not. Just give me a okay, do let me know in the chat section if the live stream has started. Check one. Yeah. Okay, so continuing from the earlier sessions, this is a series going on that is 2 questions per day series. Every day I'm conducting 3 such sessions. That means every day I'm discussing 6 questions, and these 6 questions I'm not discussing just at the face value. Rather, I'm after I give you enough time to answer the question in each session, then I go back to the theory part which we have completed over the course of these 2 months, and then we revise that. Okay, so this is a type of a retrograde revision which is very effective. Let me know if you're enjoying this. And okay, so on that note, let us begin today's session. Uh, you guys would be knowing about the Plus as well as the iconic subscription of for NEET PG available on the app, Unacademy app. Both of these will give you access to video lectures from top educators across the country. And the iconic subscription is in addition going to give you access to resources from Prep Ladder as well. Okay, so do try these out, because in today's scenario it is very important to have some form of a regular change, some form of a regular doubt solving or something to fall back on. Okay, in the absence of any classroom scenario. So Unacademy is also offering you additional 10% discount if you apply the educator code DRSHUKLA. Okay, this code is DRSHUKLA, Dr. Shukla, which will fetch you an additional 10% discount over and above the already subsidized prices. Okay. Now, another very important announcement is that Unacademy has come up with a Republic Day special offer, which gives you 6 months free extension of your Plus subscription. Okay, this offer is available for 1 year and above subscriptions of 1 year and above duration. Uh, uh, plus subscriptions of more 1 year or more duration, and this is the short time offer, that is from the 25th of January to the 27th of January. Okay, so please do make good use of it. And also, while you're taking the subscription, if you apply DRSHUKLA, then you will be getting additional 10% off. So suppose you're taking the Plus subscription for 1 year, you will after applying the code DRSHUKLA, you're going to get 10% discount on that, and the subscription will in effect last for not 12 months but 18 months. Okay, 1.5 years, because it is for 6 months you're getting for free. Okay, so all those who are starting their preparation right now, I think this is a very ripe time to make good use of this offer. Okay, now, all right, so I'll start with the first question, and this question is, okay, I'll give you 5 minutes to answer this. Okay, the question goes: a child presents with mousy odor in the urine and delayed development of milestones. There is reduced pigmentation of the skin and the hair. Upon feeding him with tyrosine supplementation, the serum prolactin levels were measured and found to be high. Which of the following is deficient? Understood the question? Okay, it is a kind of a long question. It is so you have to focus on the keywords. Mousy odor in the urine, delayed development of milestones, reduced pigmentation of the skin and the hair. The patient is a child. Upon feeding him with tyrosine, the serum prolactin level is found to be high. Which of the following is deficient? Okay, A. Tyrosine, B. Tetrahydrobiopterin, C. Phenylalanine hydroxylase, or D. Prolactin. Okay, you have to answer in the comment section. I'll give you 5 full minutes to look at this question, analyze it, recall what we have read, and then answer in the comments section. Okay, and then we are going to discuss this. So 5 minutes, your 5 minutes start now. Come on, all the best, everyone. Answer this. Come on, all of you who have joined. Do not hesitate to answer, okay? Even if it turns out to be wrong, doesn't matter. You just have to answer, okay? Try and answer this. Come on, 1 whole minute has elapsed. Try and answer. Three minutes left now for you. Think it through. Come on, guys. Come on, try and answer this. It is not difficult. At least try and decipher what this is. At least you can comment in the chat section as to what is this disease. 2 minutes left. 2 minutes and then I'll tell the answer, okay? What is this disease? Mousy odor in the urine, reduced pigmentation of the skin, hair. Prolactin comes out to be high. And prolactin is high. Okay, last 30 seconds and then I'll tell the answer, okay? You guys should also attend the MBBS, that is MCQ bonus biochemistry sessions on the Unacademy app. There also I discuss quite a lot of MCQs to revise. This week is specially dedicated for revision, okay? And do attend those sessions on Unacademy app, because then through that your metabolism part is going to get very strong, okay? It is going to get stronger and you will be masters of metabolism. Biochemistry is not going to intimidate you then, okay? All right, so should I tell you the answer now? Time is up. Now, the time to answer is up. Now, I'm going to tell you the answer now. The answer here is B. Tetrahydrobiopterin. Now, most of you who haven't ventured with the answer must be thinking why it's not C, that is phenylalanine hydroxylase, when the symptoms are all suggestive of what? What are these symptoms suggestive of? Mousy odor in the urine, delayed development of milestones, reduced pigmentation of the skin and the hair. What are all of these significant of? Phenylketonuria, isn't it? Now you'd be saying phenylalanine hydroxylase is deficient in phenylketonuria. So why isn't this the case? This is asking, isn't it? Isn't this what the question is asking? It is asking which of the following is deficient. So isn't it so straightforward? This is phenylketonuria. The answer should be phenylalanine hydroxylase. But have you heard of the other variant of phenylketonuria where tetrahydrobiopterin is deficient? And it produces milder symptoms. It produces a milder form of phenylketonuria. So how do you differentiate between the deficiency of phenylalanine hydroxylase and the deficiency of tetrahydrobiopterin? This is what we are going to discuss here. Okay. Now you see, phenylalanine amino acid converts to tyrosine. Okay. Phenylalanine is an essential amino acid. Tyrosine is non-essential because it can be synthesized from phenylalanine inside our body. Whereas phenylalanine cannot be synthesized in our body, it has to be taken up from outside in the diet. Okay. Therefore, phenylalanine is an essential amino acid. Now, phenylalanine converts to tyrosine through the enzyme phenylalanine hydroxylase. And this enzyme requires a cofactor, that is tetrahydrobiopterin, THB. Okay, got it? Now, if phenylalanine hydroxylase is absent, what will happen? Phenylalanine will start building up and tyrosine will be deficient. Okay, so now what will happen? Tyrosine will become essential for the body because it is not getting synthesized inside our body because of deficiency of phenylalanine hydroxylase. So, build-up of phenylalanine will lead to a lot of neurological symptoms. Why? Because phenylalanine is a large neutral amino acid. Okay, what is this? It is a large neutral amino acid. And this large neutral amino acid is transported inside the brain through the blood-brain barrier utilizing the large neutral amino acid transporter. Okay. Now, there are other large neutral amino acids also present in our body which are required for the development of neurotransmitters and other neural connections. Now, when phenylalanine is going to crowd the large neutral amino acid transporter, then the other large neutral amino acids will not be able to enter inside and there will be deficiency of neurotransmitters and neural tissue development. So, that is why the build-up or crowding of phenylalanine is going to compete against the other essential large neutral amino acids, and that is what is going to cause the neurological symptoms like microcephaly, behavioral abnormalities, attention deficit hyperactivity disorder, that is ADHD. Okay, all these things. And mousy odor in the urine because of presence of phenyl ketones. Okay, what are phenyl ketones? See, phenylalanine is getting excess in the body. Alanine is an amino acid. Amino acid gets converted to keto acid. Okay, through transamination reaction. This is a reversible reaction, reversible conversion of amino acid to keto acid. So here the alanine is getting converted to pyruvate. Okay, pyruvate is a keto acid. So, this phenyl pyruvate gets lost in the urine and this is called phenylketonuria, the presence of phenyl ketones in the urine. Okay, got it? Now, there is the deficiency of phenylalanine hydroxylase enzyme which leads to deficiency of tyrosine. This deficiency of tyrosine is going to cause reduced pigmentation of the skin and the hair. And why is it so? Because tyrosine produces melanin. Okay. Tyrosine is required in the synthesis of melanin, and melanin is present in the melanin is what gives pigmentation to the skin and the hair. Okay, understood? Now, coming back to our question, the deficiency of phenylalanine hydroxylase is going to build up phenylalanine and is going to lead to deficiency of tyrosine. Okay. But what did I tell you? This phenylalanine hydroxylase also requires a cofactor. What is that cofactor? It is tetrahydrobiopterin. Now, if tetrahydrobiopterin is deficient inside our body, it will also lead to a decreased functioning of phenylalanine hydroxylase, and that is also going to lead to a milder form of phenylketonuria. Okay. So, how do you differentiate between the two? This can you look at this reaction? Phenylalanine converting to tetrahydrobiopterin through the enzyme phenylalanine hydroxylase in the presence of tetrahydrobiopterin. Now, tyrosine gives rise to catecholamines, that is L-dopa, dopamine, through the enzyme tyrosine hydroxylase in the presence of tetrahydrobiopterin. Okay. So, this tetrahydrobiopterin is the cofactor for both phenylalanine hydroxylase as well as tyrosine hydroxylase. Okay. Now, this dopamine which is produced by tyrosine, dopamine inhibits prolactin synthesis. So, whenever dopamine will be synthesized, it is going to reduce serum prolactin. If dopamine is not present, it is going to increase serum prolactin. Understood this much? Now, consider scenario 1 where phenylalanine hydroxylase is deficient and tetrahydrobiopterin is normal in concentration. In this scenario, what will happen? The first reaction cannot occur. Conversion of phenylalanine to tyrosine cannot occur because phenylalanine hydroxylase is absent. Now, this reaction, if you give him tyrosine from outside, then this next reaction can fully continue. How? Because tyrosine hydroxylase is present and tetrahydrobiopterin is also present. So, if you give him tyrosine, he will be able to synthesize dopamine and that will inhibit prolactin. So, serum prolactin levels will be low. Now, consider the second scenario where tetrahydrobiopterin is deficient. Okay. Phenylalanine is present but tetrahydrobiopterin is deficient. So, the activity of phenylalanine hydroxylase is going to be reduced and tyrosine is going to be produced in very minute quantities. And this tyrosine cannot produce dopa or dopamine. Why? Because this cofactor again is required here and this is deficient. So, dopamine is not getting produced. Therefore, serum prolactin levels will be high. So, in the presence of tyrosine, if the serum prolactin levels are high, that means tyrosine is not getting converted to dopamine and therefore the deficiency is not in phenylalanine hydroxylase, rather the deficiency is that of tetrahydrobiopterin. Understood this or not? Have you got this or should I repeat? Understood how we narrowed down to what is deficient? Okay. So now, and about Guthrie's test also you would be knowing that Guthrie's test is a screening test for phenylketonuria that is conducted in in neonates during the from the 3rd to 5th day, around 3rd to 5th day of birth. Okay. Jatin wants to repeat. Okay, Jatin, I'll repeat this. From where do you want to you want to know how to differentiate? See, phenylalanine converts to tyrosine and tyrosine forms catecholamines. Okay, catecholamines are what? Dopamine, epinephrine, norepinephrine, all these. Now, tyrosine utilizes the enzyme tyrosine hydroxylase, which converts to L-dopa and then it converts to dopamine. Okay, dopamine will inhibit prolactin synthesis. Okay. So, if you have to see whether dopamine is present in the body or not, look at the prolactin levels. If the prolactin levels are very high, that means dopamine is not getting produced because, no, this is just a rough measurement. It does not mean that this is in prolactinoma also you can blame dopamine. I'm just saying if you look at serum prolactin levels, if they are high, that means dopamine levels are low. If serum prolactin levels are low, that means dopamine levels are high. Understood? So, if dopamine is getting produced from tyrosine, it is going to lower prolactin levels. Okay. Now, you find a patient with symptoms of phenylketonuria. You want to know whether the deficiency is in phenylalanine hydroxylase or whether the deficiency is in tetrahydrobiopterin. So, what do? You give him tyrosine and you check the levels of prolactin. Okay. Now, if the deficiency is in phenylalanine hydroxylase, then this first reaction cannot happen because this enzyme is itself deficient. Okay, now you're giving him tyrosine from outside. He's taking tyrosine and he has tyrosine hydroxylase inside him. He has tetrahydrobiopterin THB inside him. So this tyrosine can further undergo these reactions and it can produce dopamine. Okay, this dopamine is going to inhibit prolactin synthesis. So tyrosine will form dopamine which will inhibit prolactin. Therefore, in the deficiency of phenylalanine hydroxylase, prolactin levels will be low. Why? Because dopamine is getting formed. Okay, because the further enzymes are not affected. Whereas in the deficiency of tetrahydrobiopterin, what happens is that this second reaction also cannot proceed because this also requires this cofactor tetrahydrobiopterin. Therefore, in the deficiency of tetrahydrobiopterin, dopamine is not getting formed and prolactin levels are high. Understood this now? Understood, Jatin? This is how you differentiate, okay? Now, let us move to the next question. Come on, I'll give you 5 minutes to consider this question. Which of the following enzymes catalyzes the release of tyrosine and iodide from monoiodotyrosine and diiodotyrosine inside the thyroid follicle? Is it A. peroxidase, B. oxidase, C. iodinase or D. tyrosinase? Okay? Understood? Which of the following enzymes catalyzes the release of tyrosine and iodide from MIT and DIT inside the thyroid follicle? A. peroxidase, B. oxidase, C. deiodinase or D. tyrosinase? Okay, got it? Now your time starts now. Try and answer. Jatin, first answer this question. Prolactin decrease. See, symptoms, you're not concerned with the symptoms. Symptoms of prolactin, prolactinemia, decrease in prolactin, increase in prolactin. Prolactin is required for formation of milk. Okay. All these you don't require to know right now. You just want to know the serum prolactin levels. Okay. You're not checking the symptoms of prolactin there. You're checking the serum prolactin levels. Okay. Understood? It is a child that you're talking about. Okay. Now try and answer this question. Come on, guys, all those who are attending, try and answer this question. Jatin, attempt this question. What is the correct answer? Come on, time is running out. Just 3 more minutes left. Try and answer this question. Which of the following enzymes catalyzes the release of tyrosine and iodide from MIT and DIT inside the thyroid? Peroxidase, oxidase, deiodinase or tyrosinase? I don't see any answers coming in. Those who are attending, you should answer this, guys. It is not a good habit to avoid answering or to avoid questions. No. It is appreciated if you put your knowledge to test every time. Otherwise, what will happen is it will get rusted. Testing yourself time and again is very important. Come on, last 2 minutes left. the habit of just attending the theory part and not subjecting yourself to test is not good. That is what I'm telling you. No matter how many motivational strategy sessions, theory sessions, no matter how many books you read, it will be a waste if you don't quiz yourself, test yourself from time to time. Please mark my words, guys. I'm telling this out of experience, okay? It is very important to quiz yourself from time to time, and there should be no shame in attempting any answer, even if it is wrong. You take my advice, well and good. If you don't, then you'll see for yourself, because what I see is there's a trend in during my lectures. There's a trend that people attend the theory part. They ask their doubts, they get their doubts solved, but whenever there is the time comes for them to attempt quizzes, they vanish. This is not right. This is in your own interest that I'm telling you. I'm taking pains to come up with 3 classes per day. 3 classes, three unique, which contain 6 unique questions that I have designed to be tailored so that I discuss a major chunk of your syllabus. This is from clinical biochemistry that I have taken this question, and this will discuss your thyroid hormones part. Okay, and it will not be appreciated if you guys do not attempt questions. Okay, Jatin says D. Last 30 seconds and then I'll tell you the answer. Release of tyrosine and iodide from monoiodotyrosine and diiodotyrosine inside the thyroid gland, inside the thyroid follicle. That is where the thyroxine hormone gets synthesized. Alright. So the correct answer here is C, D-iodinase. Okay, what is this enzyme? D-iodinase. Okay, this enzyme has the component of this enzyme constituent is selenocysteine. That is the 21st amino acid is present in D-iodinase. Where else is selenocysteine present? In one very important enzyme. Selenocysteine is present in one very important enzyme. Tell me, guys. Tell me this. You would have read in your first year. I have discussed this time and again. I have discussed about this enzyme. I have told you when I was discussing the chapter of proteins, that then also I was telling you. There is the other enzyme called glutathione peroxidase, which also contains selenocysteine. It is very important. It is an antioxidant, extremely important. Antioxidants, I don't know how many times I have discussed. Now, sometimes I tend to get very disappointed with the response, especially because I don't know why, even after so many revisions, you guys fail to be active in discussions. Okay, so it really bothers me because even after discussing something time and again, what do? Is you prefer not to be interactive, you prefer not to be active in discussions. I don't know why, what you're scared of. Even if you answer wrong, I'm not going to get disappointed or upset. I'm going to get upset and disappointed only if you choose to shy away, to hesitate, to run off from answering. This series is specially dedicated for you to quiz yourself. It is not dedicated for you to just know the answer and the explanation. Then it serves no purpose. Then it will be just like a theory class. Okay, for it to be of any value, you have to test yourself. That is how you're going to develop your thinking skills. That is how you're going to develop your thought process. Otherwise, what I can do is, just like any other educator, I can come in and I can discuss whatever I have taught. I can just keep on reading by rote, and then it will be good for you. I think it is getting. I think I'm getting. You guys are really annoying me by your response. You're just attending the lectures and not participating in the answering. That is really getting onto my nerves now, because then there is no difference in this lecture and any other lecture. This lecture will then be just like any other lecture, with no interaction with what is the purpose of me coming up with unique MCQs, with coming up with unique questions that are designed specially to make you revise the entire syllabus. I'll also come and I'll also then just keep on reading everything and make you learn everything by rote. What is the purpose of this interaction then? Anyway, so The answer is the enzyme deiodinase. The enzyme deiodinase has two functions. One, inside the thyroid follicle. Inside the thyroid follicle, this enzyme dissociates tyrosine and iodine from monoiodotyrosine and diiodotyrosine. So let us first discuss, let us first revise, because this is what you are here for. You're just here for checking up the explanation. Okay, you just do that, and then when you're going to repent, that is when you're going to think of what I told you. That is when you're going to remember what I told you. Okay, so this is what inside the thyroid follicle, the synthesis of thyroxine hormone takes place. The first step in the synthesis of thyroxine is to concentrate iodide ions against their concentration gradient inside the thyroid follicle. Outside the thyroid follicle, the concentration of iodide ions is low. So movement of iodide ions from an area of low concentration to an area of high, from an area of high concentration. See, movement of movement of iodide ions outside, opposite their concentration gradient, is called active transport. Okay, so actively they are transported inside from an area of low concentration to an area of high concentration. Okay, now this is done through the transporter, the sodium potassium ATPase iodide transporter. That is, this transporter is moving iodide ions against their concentration gradient. Therefore, it will require energy, and this energy is coming from sodium potassium ATP. Okay, now once the iodide ions are concentrated inside the follicle, they undergo oxidation through the enzyme peroxidase. That means I minus is going to form I plus. I minus has an excess of electrons, I plus has a deficiency of electrons. So there is a loss of electrons that is happening. Loss of electrons is oxidation. So I minus has undergo oxidation through the enzyme peroxidase to form I plus. Now this I plus can iodinate the tyrosine residues present on the thyroglobulin molecule. This thyroglobulin molecule has around 115 tyrosine residues which can all be iodinated. That means iodine can add on to the tyrosine residues. After adding on to the tyrosine residues, what is formed? Monoiodotyrosine and diiodotyrosine. Diiodo means two iodine molecules have attached. Now, this monoiodo is, mono means 1, di means 2. Now, these will couple together. That means they will also join together. If 1 and 2 join together, 1 plus 2 is 3. It will form T3. If 2 DIT, 2 plus 2 will join together, 2 plus 2 is 4. It will form T4. Got it? Now, this thyroglobulin molecule containing MIT, DIT, T3, T4, it is stored inside the colloid to be used whenever the time comes. Now, whenever the thyroid gland is stimulated by TSH hormone, this thyroglobulin is invaginated inside through phagocytosis. It forms phagosome. This phagosome is bound to the primary lysosome to form the secondary lysosome. Secondary lysosome or the phagolysosome has hydrolytic enzymes which will digest and remove the T3 and T4 outside in the circulation. And the MIT DIT are also removed from thyroglobulin. And now what happens is the iodine inside this MIT DIT and the tyrosine, they are separated by the action of the enzyme deiodinase. This iodide and tyrosine can then be reused. Okay, so this deiodinase enzyme containing selenocysteine, inside the thyroid follicle, it separates iodide and tyrosine, the MIT and DIT. And outside in the peripheries, in liver, kidney, what does deiodinase do? Deiodinase converts T4 to T3. Now T4 is a lesser biologically active form of thyroxine and T3 has the maximum biological activity. So most of the T4 is converted to T3. Okay, understood this? So this was all. Now I'm going to take a break for a few minutes and I'm going to start with the next 2 questions per day series. I hope you guys attend that with the more interaction than this one. Okay, and I'm not forced to lose my temper. Okay, if you haven't subscribed to this channel, then do subscribe to it if you want to learn, that is. If you don't want to learn, if you just want to do rote learning, then it is up to you.